Hi, my name is Dr. Fiona Tassoni, and I'm a doctor of Chinese medicine and also the founder of the Pregnancy Accelerator program, which helps women just like you conceive naturally or support women undergoing IUI or IVF with a combination of Western medicine and Chinese medicine. I'm here today to talk to you about the mystery disease of women, which is more than a painful period, takes an average of 10 years to diagnose, and also the leading cause of infertility in women today. I'm talking about endometriosis, otherwise known as endo, which is a whole body disease that affects women physically and emotionally and is a chronic progressive condition. Endo occurs when the tissue similar to the lining of the uterus gets implanted outside of the womb and the pelvic cavity. And over time, adhesions can form in the reproductive organs, in the intestines, the bladder, and can even spread as far as the nose. There have been some reports of patients suffering from nosebleeds at the time of their period. This condition affects 1 in 10 women, which makes it more than 180 million women worldwide. And unfortunately, it is unknown what causes it, although there is a possible genetic link and other factors at play, such as environmental endocrine disruptors, estrogen dominance, leaky gut, and there are theories that endometriosis may be autoimmune. That is why the treatment focus needs to include the reduction of inflammation. Those who have endo are 20% more likely to experience depression and 50% more likely to have infertility issues. Although your doctor may suspect you have endo, a laparoscopic surgery is the only way to diagnose endo. This involves taking a biopsy, which means cutting out the suspicious tissue during surgery, and confirmation by a pathologist who can study the tissue under the microscope. There are several different surgical treatment methods available. Ablation surgery is quite common. However, it can often leave the disease behind, and there's a higher recurrence rate. So excision tends to be the gold standard to remove endo, and the last resort is a hysterectomy. Sadly, there's a 50% chance that the disease will come back after the surgery, and if it does, you'll have to undergo more surgeries. You never know when endo will hit. You have constant fear it will come back, and you'll never know if you are cured. It's a bit like having cancer, only you don't die from it. There are so many myths around the cures for endo. However, pregnancy is not a cure, a hysterectomy is not a cure, surgery is not a cure, and birth control is not a cure. Some of the more common symptoms include the intense period pain. You've got this severe abdominal bloating, heavy bleeding, other things like irregular periods, severe fatigue and chronic fatigue. You may have gastrointestinal problems like IBS or pain during intercourse, bowel or bladder problems, cysts, pain during ovulation, hormonal imbalances, pelvic pain, brain fog, depression, lower back pain, cramping, nausea, and pelvic floor muscle pain. And sometimes there may be no distinct problems or symptoms at all, and we call this the silent type of endo. It is also not a disease of white women. Because of this, many Black and Hispanic women have had their pain dismissed and their diagnosis delayed and received inadequate treatment. So endometriosis, it affects all races, ethnicities, and bodies. Clearly, the sooner the endo is diagnosed, it will significantly reduce organ damage, which is why we need to raise awareness and start paying attention to the early signs and stop thinking that painful periods are normal. Fortunately, Chinese medicine and acupuncture can help limit the proliferation of endo and relieve some of the uncomfortable symptoms associated with endo by improving the blood flow, reducing the inflammation, balancing the hormones, and decreasing the pain. So we often combine Chinese medicine with conventional medical treatment, and we see it as an inflammatory condition caused by blood stasis. However, to treat it properly, a good practitioner will also need to diagnose and treat the root cause of the stagnation. Initially, we would begin with an anti-inflammatory diet, as this will systematically provide some relief and reduce some of the overall pain and inflammation. The main things I want to reinforce with endo is to avoid cold and raw food. Cold creates more stagnation, and this will only increase the pain and inflammation. So we want everything closer to your body temperature, i.e. warm foods, so to not overly tax your digestion. So for this reason, it's best to lightly steam, saute, stir fry, and just cook your vegetables so they're easier to digest. And we also want as much warming foods like soups, stews, your slow-cooked food. And there are other things to avoid, such as your sugar, caffeine, gluten, dairy, alcohol, and meat, because they trigger inflammation and create those hormonal imbalances that impact the adrenals as well. So we want you to consume lean and organic meat and poultry and hormone-free where possible. Avoiding soy as it affects your thyroid, and also soy is a potent phytoestrogen, which are compounds that mimic estrogen. Small size servings of fermented soy products are okay, such as your tempeh and your miso, but you want to keep or add foods that benefit, nourish and heal, such as your cruciferous vegetables, which are your broccoli, your cauliflower, your cabbage, bok choy, Brussels sprouts and kale, as they support that healthy estrogen metabolism and they eliminate the excess estrogen from the body. Also add more sulfur-rich foods, which are your cruciferous vegetables and your alliums, your onions, your garlics and your shallots, your glutathione foods, that's your asparagus, avocados, spinach, broccoli and carrots. Now glutathione, it's the body's master antioxidant, so that helps neutralize again the estrogen quinones. You want to have your fiber-rich foods, as fiber binds to and escorts excess hormones out of the body. And good fiber include your fruit and vegetables, your nuts and seeds, your beans, your legumes, your whole grains such as your quinoa, rice and oats, and your ABCs, your apples, beets and carrots. They contain the fiber and they're also especially good at detoxifying estrogen, and you can have those daily. We also want to add foods to support the liver and promote bile production, as the liver detoxifies the hormones by dumping them in the bile for elimination. So your liver-friendly foods are your cruciferous vegetables, your bitter greens, your radishes, your garlic, your lemon juice, over your kale, and your sour foods such as your kimchi and your pickled vegetables. You also want to include healthy fats and oils because they play a role in decreasing that inflammation, and some of those fats include your avocados, which I love, ghee, eggs, fish, nuts, seeds, olive oil and coconut oil. I also suggest anti-inflammatory spices such as your turmeric, garlic, ginger, and by following these guidelines as a whole, you'll reduce the inflammation and pain, regulate your hormones, reduce some of the masses and the proliferation, and improve that blood circulation. So some supplements I recommend for endo include your magnesium, your melatonin. Clearly we want a B complex. The B6 particularly helps with melatonin production. You've got your zinc, your NAC, your resveratrol, which is going to decrease the inflammation. Also your essential fatty acids. But again, for the vegan people and the vegetarians, we've got your plant-based things like walnuts, flax seeds, chia seeds, hemp seeds, edamame, seaweed, and algae. You also have your evening primrose oil. We've also got turmeric or curcumin. It's often pronounced one or the other. A good probiotic, vitamin D, vitamin C, vitamin E. So while getting out of pain is not the root cause of the solution, it is a very necessary part of the process. So in addition to the acupuncture, I find the most superior and most natural way to relieve the pain, but you could also apply your heat packs, your castor oil packs, practice some of your lower diaphragmatic breathing. You could try your meditation, see a counsellor or a therapist, because you want to manage your mental health and your emotional health. Clearly reduce your stress, and where you can, just get out of your mind and into your body and spirit and get your body into that calm and nurturing place. Moderate exercise is great for endo, and you want to do things that help not only reduce stress and inflammation, but also invigorate that blood circulation. So opt for things like walking, gentle yoga, Pilates, Qigong, Tai Chi, with a 7 to 15 minute high intensity interval training sessions. And you might want to do those 2 to 3 times a week. Just keep in mind that if you do have those adrenal or other health issues, you'll need to modify your exercise to best suit what your body needs. I hope you've enjoyed some of the practical tools I've shared with you today to get you out of pain perhaps minimize or eliminate the need for more medications and pain medications, and healing endometriosis naturally so that you're in a comfortable place in your body, but you also then have the energy, the stamina and motivation to heal.